Hi, my name is Dr. Saqib Mohajer, and I'm going to be talking in this video about dental implants. This is something where there's a lot of confusion about implants, there's a lot of fear about implants, so I just want to give you a general concept of them, and we'll go into detail in a couple other videos as well. So the main thing really is, as far as the procedure itself goes, dental implants are something that our success rate is very, very high nowadays. If you asked me 10, 15 years ago, would I get a dental implant or would I get a bridge, I would actually have a debate there. We could discuss whether or not doing an implant or a bridge, one would be better than the other. But nowadays, our success rates are at 98% or higher. And the reason for that is that the materials have improved, the style of placement has improved, the surgical access, everything associated with the procedure has improved to the point that it's highly predictable and very easy to do. The advantage here at Pinewood Dental is we do everything in-house, so we actually do not refer to specialists unless it's an extremely complicated case. So most people, I'd say again 95% of people who are candidates for dental implants, I can place the implants right here in the office. Now the material itself is medical grade titanium, so it's the same type of titanium you would find in a hip replacement or a shoulder replacement, a joint replacement. You're not going to set off metal detectors at the airport or anything like that, and it's a very small piece. The implant itself is tiny, and I'm just going to show you as a little comparison here. This is a paper clip, regular size paper clip, and that is a dental implant. So really tiny. I mean, literally we're talking about, less than a centimeter, sometimes a centimeter and a half, if that long, and then very, very small. So people always think they're going to get this giant, tooth implanted in them, and that's not the case. With implants, basically you're looking at one thing. It's replacing the root of the missing tooth. So the tooth that's gone has a root that's below the bone and has a crown that's above the bone, and the implant replaces that root. After that's placed and locked into the bone, then we come back and put a crown on top of that to actually replace the missing tooth. In terms of the bone, one of the best advantages of implants is that it preserves bone that's already there. So bone in the mouth is not like bone in other parts of the body. It's use it or lose it. If you have a tooth there, the bone stays, the bone is strong, and it remains. If you don't have a tooth in an area, that bone will start to shrink over time as the body kind of melts that bone away and puts those assets somewhere else, so to speak. So in the jaw, when you have an implant placed, it actually maintains that bone for a longer period of time. It actually keeps it healthy, and the longevity of that area is maintained. The procedure itself is very simple. We do it under local anesthetic. We don't do conscious sedation because it's such an easy procedure to do. In the past, again, people would get sedated for implants. It's not necessary anymore. We actually use a CT scanner here that allows me to fully treatment plan the whole case in 3D prior to placing the implant. So I map out your nerves, I map out your sinuses. We map out every possible space that can cause a complication so that at the time of surgery, we have no complications. That's the wonderful thing about the pre-planning that we do. At the time of the surgical visit, we just give you local anesthetic. We open the tissue slightly. We make a very small incision. We actually place the implant into the bone. Once the implant is placed, we close it up tight. So we put, resorbable stitches there, and everything is basically it's pretty much like you walked in, except get a small, a couple stitches here and there. In terms of pain, people always ask how painful is the procedure. It's not. It's an inflammation issue. There's no nerves in the bone, so you don't actually feel pain from the implant. What you're feeling is the bone is inflamed. I mean, we've just put something in the bone, so it creates a little bit of an inflammation response. So we give typical pain medication for that. We may give antibiotics, to preserve to prevent any possibility of infection. But other than that, I mean, it's a pretty straightforward procedure. It does take some time for the implant to integrate into the bone, but those are things that we talk about, and it's case by case depending on how long it takes. That's pretty much it for dental implants. I mean, it's a very simple procedure. I will have other videos as well, and those are going to show, in general, the different types of implants. So we have single tooth, multi-tooth, depending on what we're restoring. Are we restoring the entire arch? Are we just restoring a single space? So I'll have a video on that. And then we'll also have a video on the CT scanner in general to show how the process is. How do we actually go from, step 1, step 2, step 3, and place the implant virtually so that we can make that surgical visit easy. I hope that was informative, and like I said, look for more videos to come. This is Dr. Saqib Mohajer. Thank you.